Welcome everybody. We are going to be talking about diabetes self-management, and my name is Kimberly Boone and I'm the registered dietitian here at Church Health. This is a 4-part series. We're going to start with Diabetes 101, then we're going to get into diabetes and medications, diabetes exercise and self-care, and then my personal favorite, diabetes and nutrition. So let's get started. First part is diabetes basics. And before we get into the nitty-gritty, we do need to know that diabetes is controlled by 3 main things: medication, nutrition, and exercise. But first of all, we need to know what is diabetes. So whenever you eat food, some of those foods get broken down into blood glucose. Some people call it blood sugar. And everybody on the planet has blood sugar in their blood. That's normal. What happens with a person with diabetes is that whenever that blood sugar rises in the blood, there's a hormone produced by the pancreas and the beta cells called insulin. And insulin acts like a key, and it comes over to the cell, unlocks the cell, and helps blood sugar to get inside the cell. That's also normal. But what happens in diabetes is that the blood glucose can't get into the cell efficiently. The key is rusty. It can't unlock the cell for the blood sugar to get inside. It usually starts out with something called insulin resistance. And that's basically where your body is making enough insulin, but the lock is rusty. It can't get in. So the keys don't work very well at opening the doors into the cell. Eventually, your pancreas is producing more insulin to compensate for this, and then it's producing more insulin to compensate for this, and more and more and more. And eventually, the pancreas and the pancreatic beta cells get tuckered out. They don't work anymore. They get overly tired. And then you're not producing the insulin, so that's insufficient insulin. So usually it starts out as insulin resistance, and then later the disease can progress where it is insufficient insulin is being produced. So how do we diagnose diabetes? There are several ways to diagnose diabetes. The first is a fasting blood sugar. So fasting meaning you have gone 8 hours or so without having anything to eat, and they take your blood sugar. And on more than one occasion, that's key, because if you come in and you're sick or something, your blood sugar could be elevated. But on more than one occasion, if it's above 126, then that could mean a diabetes diagnosis. If it's between 100 and 125, that's pre-diabetes. That's the warning signs that we're always talking about. And it should be between 70 and 99, less than 100. That's a normal blood sugar. So what is prediabetes? That is the caution sign. That's the yellow blinking traffic light. That means that this is a big warning to your body that something needs to change. And I always tell people, if you've been diagnosed with prediabetes, you're very lucky. Because if you've gotten all along your life and you have not been diagnosed with diabetes before, and then you come in and you're already diabetic, you can't really reverse that. It's irreversible. Prediabetes, on the other hand, is reversible, so you can do something about prediabetes. If you have prediabetes, for one, if you lose weight, and if you get 150 minutes of exercise a week, that's about 30 minutes or so a day, you can reduce your risk by 58%. That's for developing type 2 diabetes later on. So a point here that I would like to make is just 150 minutes of exercise a week. That can be divided up. So we say 30 minutes per day, but you could do 5 minutes in the morning, 5 minutes in the afternoon, 10 minutes here, 15 minutes here. It doesn't have to be all at one chunk. That's when people get intimidated. So you can do 150 minutes of exercise a week, and then that will lead to weight loss, which reduces your risk. Now, what are the signs and symptoms of diabetes? So there are lots of signs and symptoms, and you may have one of these, you may have more than one, you may have all of them. Really just depends on the patient. So frequent urination is one, fatigue is another, increases in thirst, You got to think, your body is unable to get the sugar into the cells. So that sugar is getting built up in your blood, and your body is trying to get rid of it. So it's trying to dilute the blood. That's why you get thirsty, and therefore you're going to be using the bathroom more often. You're going to be tired because your body is unable to get that blood sugar from the blood into the cells, and your cells are being starved. So you're going to get tired because your cells are unable to use that blood sugar for energy. You could also have dry skin or tingling and numbness in the hands and feet. You could also have sudden vision changes. That's a big warning sign as well, is if your vision suddenly changes, you need to go and see the doctor. And then unexplained weight loss, again, because that blood sugar is unable to get into the cell. Most people automatically assume that you're going to be overweight, but actually you could have some weight loss because your cells are being starved. Your body can't get that blood sugar for energy, and it's being excreted in the urine, so you're going to lose some weight. It's not using that blood sugar efficiently. There's type 1 and type 2. Type 1 diabetes used to be called juvenile diabetes. We used to think that only kids could get this. It's usually identified in children, teens, and young adults, but it could be diagnosed much later. I've had a patient before that was 82 years old whenever she was diagnosed with type 1 diabetes, so it can happen. It's rare, but it can happen. Type 1 diabetes, unlike type 2, is where they have no insulin. Those pancreatic beta cells are not producing insulin at all, little or none. We think this is because a virus perhaps happened and it caused our bodies to attack those pancreatic beta cells, so it's considered an autoimmune disease. Therefore, the pancreas is unable to produce any insulin, and those keys are not being made. So they, type 1 diabetics, are solely dependent on insulin. They have to take insulin. 90% of all cases of diabetes are type 2 diabetes. So again, that's where you're going to get insulin resistance, and eventually those pancreatic beta cells are going to get tired and you're not producing enough insulin at all. What puts you at risk for developing type 2? There are several things that are modifiable that you can do something about, but there's also some things that you can't do anything about. So as we age, we have an increased risk of developing type 2. Our genetics, family history, could put us at increased risk. If you have gestational diabetes, you may or may not be familiar with that term. I have a whole slide on that later, but that's where you get diabetes diagnosed whenever you're pregnant. And your ethnicity. Minorities, African Americans, Hispanics, tend to be at higher risk for developing type 2 diabetes. Let's focus on the things that we can change. A sedentary lifestyle, so getting more movement. That 150 minutes a week is ideal. Unhealthy foods, that's for sure. We can do something about that. If we're overweight, we could potentially lose some weight. If we have high blood pressure, we can also affect that with the foods that we're eating and our exercise, stress management. And if we have prediabetes, that's that warning sign to do something about it. Being obese or being overweight can put you at higher risk for developing type 2 diabetes, but it really depends on where that weight is being distributed. If you're carrying your weight above the waist, that's going to be a higher risk body shape. So we call that apple shape. If you've got a broader chest, or if you're carrying your weight more on your abdominal section, that's going to put you at a higher risk. A lower risk body shape is if you're carrying your weight below the hips, below the waist and the hips and the thighs and the buttocks. That is a lower risk body shape. Now, gestational diabetes. If you're pregnant, you're going to get this test. And what they're going to do is give you this bottle of a very sugary drink, and you're going to come in a couple of hours later and be tested in your doctor's office to see what your blood sugar is. That test is going to let your doctor know whether or not you are at risk for developing type 2 diabetes later in life. A lot of people don't realize that that is related, but it definitely is. 35 to 60% greater chance of developing type 2 diabetes if you are diagnosed with gestational diabetes. The thing with gestational diabetes is it does usually go away after the birth of the baby. So how do we manage our diabetes? Diabetes is a chronic disease. It means it's long-term. It's not something acute like a cold or strep throat. It is progressive and it is chronic. And what I would like to point here is that 95 to 99% of the daily care of diabetes is self-care. You have just as big a role in controlling your diabetes as your doctor does. And there are several things that you can do to better manage your diabetes. You can check your blood sugar more regularly, manage highs and lows, know what your numbers are, and know what those numbers mean, more importantly. And if you do those things, you can prevent complications from diabetes later on. So why check your blood sugar? So blood sugar provides immediate feedback and data and allows you to make changes in the management of diet and exercise, and it also allows your doctor to see how well you are controlling your diabetes. So again, it tells you how well your diabetes is being controlled, allows you to make changes if necessary to your diet and exercise regime, and it lets your doctor know and you know if your medications are working properly. So how often should you check your blood sugars? So this is going to depend on your provider. It's also going to depend on what medications you're taking. It's also going to depend a lot of time on cost because those testing strips can be quite expensive. The American Diabetes Association recommends for people on multiple dose insulin to check in several instances. Prior to meals and snacks, occasionally after meals, we call that postprandially, at bedtime, prior to and after exercise, and after treating a low blood sugar until they are considered normal numbers. You definitely want to check more often when there's been a change in your medication or your insulin dose. You also would want to check before taking insulin and sometimes after insulin when you are sick, but most importantly, this is going to depend on whatever your doctor recommends for you. Generally, if you're on an oral medication for diabetes, you're going to want to check fasting or before a meal and 2 hours after the start of a meal. This isn't always the case. So again, this is individualized depending on what your doctor tells you. Generally, if you're taking insulin, you're going to want to take a blood sugar number before taking your insulin, but again, following the instruction of your providers. So how do you check your blood sugar? You're going to use something called a lancing device. And this lancing device has a twisty top, usually with different numbers on it. The lower number means it's going to be shallow in your skin, and then the higher numbers are deeper in the skin to penetrate with something called a lancet. So a lancet is the needle. That's what we call the needle. And the biggest thing here is when we're taking that plastic piece, as you can see at the top, off of your lancet, you don't want to take it off at an angle. You're going to want to pull it off directly. You don't want to bend the needle. Also, you only want to use these needles one time. The reason for that is because of infection risk, and you always want to use these needles on clean skin. So how do you use your meter? So you're going to use something called strips. These testing strips, you're going to inject into the meter, and a drop of blood is going to come up, and that means that the device, the meter, is ready for your blood. So you're going to test with your lancet in your lancing device, get a little bitty drop of blood, it doesn't take much, and insert it into the strips. Now, what end do you put into the machine? I like to say this is the digital end. So it's more digital looking, or piano keys, some people like to call them that. You're going to insert this into the meter, and that's when the blood drop is going to come on. Now, the strips do expire, and you're going to want to avoid temperature extremes. So we don't want to put our strips in our car, for example, especially in Memphis where the weather can get quite hot and quite cold. You also want to store your strips properly, so you're going to want to store them in the container that they come in. And you're going to make sure that container is closed and sealed. You're also going to want to wash your hands before you get started. If you have eaten something sugary recently and the sugar is still on your skin, when you prick your finger, your blood glucose meter could be measuring the sugar that's on your skin, and therefore it's not going to be accurate. So we want to make sure that we have clean skin and that you're using the side of your finger, not the pad, whenever we're checking our blood sugar. The pad can hurt. We want to use the sides of our fingers. And if we can't get enough blood or our hands are cold, you can gently milk the forearm up to the fingertips to get more blood if we need to. Also, a lot of people don't realize that those meters come with a control solution. So every time you open a new packet or bottle of strips, you're going to want to check and make sure that your meter is registering properly and it's registering accurately. And they do this by providing a control solution with your meter kit. Now, when this control solution is open, it usually expires about 3 months later. And in that case, you can call your doctor or call the company that owns your meter and get them to send you new control solution. And you're going to want to look at the directions for your control solution. Usually it gives you a range of where your meter is supposed to be registering. So you'll use this the same as you would blood. You're going to put the strip inside the meter, wait for the little blood droplet to come on, put a little bit of this control solution on the strip, and wait for the number to pop up. Then you're going to go to the directions and see if it's within the range that it needs to be in to make sure that your meter is registering accurately. You may want to do this also if you have checked your blood sugar and you feel low but it's not registering you as low, or you check your blood sugar and it's really high and you think that that maybe is not accurate. So we want to check this periodically just to make sure. Also, how do you properly dispose of these needles? So we're going to talk about sharps disposal. There is a proper way to do this, and it's Tennessee state law that we dispose of these properly and safely. Now, you can go and purchase a sharps container at your local Walgreens or Walmart. They're not very expensive, and then you can throw those away in your trash, or most people bring them to their doctor, or you can make your own sharps container. So what you would want to do is use a plastic or metal bottle that is hard plastic, opaque, not see-through. Okay, so you don't want to use something like a Coke bottle, for instance. That's going to be too thin. You're going to want something that's sturdy and durable. Then you're going to label that with sharps, hazardous material, do not recycle, and you're going to fill it until it's about 2/3 of the way full. At that point, you're going to want to put the cap on it nice and tight and wrap duct tape around it to make sure that really is sealed properly, and then you can throw that away in your local garbage. So what are your blood sugar goals? Again, this is going to be individualized, but generally speaking, a fasting or before a meal number, we're going to look to see if it's between 80 and 140, within that range somewhere. 1 to 2 hours after we eat, we're going to look for a number that's between 140 and 180. Now, some of you may be watching this and thinking, I am never going to get down to those numbers, or my numbers are never that low, and that may be the case for you. But this is going to be individualized, and these are just general numbers. How do we know what our blood sugars are? Logging our blood sugars are going to give us the most control. This is going to show our provider what our blood sugars have been. So your provider can only see your blood glucose in the clinic that day. They don't know what it's been 2 weeks ago, for the whole month. So this way, if you're recording every time you take your blood sugar and writing it down, the time, writing down ideally maybe what you ate as well, or if it's been in relation to a meal, how long after that meal. Just getting a really accurate blood sugar log is going to be really beneficial for your provider and for you to know how well you are managing your diabetes. In terms of managing, what do we do if there's been highs and lows? And what are highs and lows? So we say hyperglycemia. If you break that word down, hyper means high and glycemia means sugar. So literally meaning high blood sugar. Same thing with low blood sugars. hypoglycemia. And ideally, we really don't want to have these drastic highs and lows, this roller coaster ride. We want there to be a pretty even ebb and flow to your blood sugars throughout the day. So the better managed, the less likely you're going to have these issues. Now, we do want to know what we need to do in case we have hyperglycemia. So hyperglycemia is characterized as having a blood sugar of more than 140 if you've been fasting. Again, that's before a meal, if you haven't had anything to eat. 2 hours after a meal, if it's more than 180, that's characterized as also being hyperglycemic. And some of the symptoms for this could be very thirsty. Again, your body's trying to dilute that blood sugar in the blood, needing to urinate, dry skin, you're hungry, you have blurry vision, you're tired, slow healing injury or infection as well. So for example, you're getting rid of a lot of this excess sugar in your urine, and you could have UTIs, you could have yeast infections, or again, slow healing injuries. What can cause a high blood sugar? This is very important to identify in managing our diabetes. For one, did you take your medication? Did you miss a dose? Did you have too many carbohydrate-containing foods? Now we're going to get into that later on, into more specifics on what foods contain carbohydrates. If you're taking too little insulin or your diabetes pills are not matching for the amount of the carbohydrates that you're consuming, maybe it needs an adjustment in the medications. You may also be sick. Sickness can cause your blood sugar to elevate. Or you have a lack of exercise, or you're really stressed out. Stress can also elevate your blood sugar. So what do you do if your blood sugar is high? For one, we're going to help our bodies to dilute that blood sugar. We're going to drink plenty of water. And then the second part is mainly for people that are type 1, but also if you have a prone to developing DKA or diabetic ketoacidosis, you're going to want to check your blood sugar before you exercise, because exercise can help to lower that blood sugar. If it's more than 300, you're going to want to check for something called ketones. And what ketones are is your body's way of breaking down and getting that energy, not through glucose, because it can't do that. It's not getting that glucose into the cells, remember? So we have to use another way, and what that's going to entail is protein and fats. It's going to start breaking down protein and fats, and if it breaks down enough of them, it could cause your body to go into ketosis and diabetic ketoacidosis, because ketone bodies are acidic in nature. So these could build up in the blood to a dangerous level. If there are ketones present, you're not going to want to exercise. You're going to want to call your doctor. If there are no ketones, then you can use exercise to manage a hyperglycemic event. You're also going to want to identify why your blood sugar was elevated in the first place. So again, looking back, if you took your medications, did you have too many carbohydrates? Have you been really sedentary lately? Are you really stressed out? So trying to identify what caused that hyperglycemia to prevent it from happening again. If you have a blood sugar of more than 180 for more than 1 week, call your doctor and let them know so that they can adjust properly. Now, hypoglycemia, remember that's low blood sugar. What does that mean? A blood sugar less than 70 is considered a low blood sugar. And some symptoms of this is going to be shakiness, having a fast heartbeat. A lot of people feel like their heart is pounding out of their chest. You're sweaty, you're dizzy or shaky, you're anxious, you're really hungry, your body's trying to get some blood energy, blood glucose somewhere. You have blurry vision, weak or tired, you have a headache, or you're generally nervous or upset. Now, what can cause a low blood sugar? Skipping meals for sure can cause a low blood sugar. We want to make sure that we are intaking foods steadily throughout the day to prevent this from happening. Drinking alcohol without eating can actually cause a low blood sugar. Exercise or very physical work, as we discussed with hyperglycemia, that's a way to lower that blood sugar, but it can go too low, so we want to make sure we're managing that. Not eating enough carbohydrates. So even if you didn't skip a meal, if you had a meal that was, say, bacon and eggs, there's not going to be any carbohydrates in those foods. So you could still have a low blood sugar even if you didn't skip a meal because you're not intaking enough carbohydrates at those meals. Or your medications are off. It's too much insulin, or the oral medication could be too high. So we want to make sure that we get that information to our doctor and get that taken care of. There are some things that you can do if your blood glucose gets too low, and 15 is the magic number in diabetes. So the rule of 15 is you're going to eat or drink 15 grams of quick-acting sugar, such as orange juice, a tablespoon of sugar, 3 to 4 glucose tablets, because each glucose tablet is around 5 grams of carbohydrates. A lot of people would just take 1 and they don't realize that it's not enough. So you got to take 3 or 4 of those glucose tablets to get 15 grams. Or a packet of jelly. So whenever you eat or drink those 15 grams of carbohydrates, you're going to want to wait 15 minutes and check that blood sugar again. If it's not more than 70, you're going to want to repeat this until it gets into a normal range. The best way to prevent diabetes complications is to have a good ABC result. So what is ABC of diabetes? A1C, blood pressure, and cholesterol. And we're going to get into those one by one. So what is an A1C test? We say this number a lot, we say this test a lot in diabetes, but a lot of people don't even realize what it is. A1C is the average blood sugar over the past 2 to 3 months. What happens in diabetes? We've already explained blood sugar is rising in the blood. That blood sugar is very sticky and it likes to stick to red blood cells. And blood cells live about 2 to 3 months, which is why we take this number. We can basically look at your blood cells and see how much sugar is attached to those blood cells. So think about a regular cornflake turning into a frosted flake. That's what we're looking for. We're looking for those frosted flakes. How much sugar is on there? And it comes out as a percentage. So for diabetes control, we try to say less than 7% is ideal. But those percentiles mean a number. That's going to be your average blood sugar that it's been for the past 2 to 3 months. So for example, a 7% average blood glucose level is 150. The higher the number, the higher the percent, the higher the average blood glucose. So for example, 13% would be that your blood sugars have been around 350 on average. Now that's not looking at what they've been every day. That's why we need those blood sugar logs. That's giving you just an average, but it's not looking at the time of day, it's not looking at what's happening at night, it's just giving you an average. So it's important to know this number as well as having those blood sugar logs to get a better idea. So what is blood pressure? The B in the ABCs. Blood pressure, high blood pressure, otherwise known as hypertension, is the force of blood on the walls of the arteries. And what can happen if that is high, if that force is high over time, it's going to cause a buildup of tissue and hardening of the arteries, which we don't want. So think about a hose and being tightened, squeezing tighter. That pressure is going to get higher and higher as that's happening. So we want those nice dilated blood vessels. The goal is less than 140 over 90. Now keep in mind, this is somebody with diabetes. Cholesterol. So what is cholesterol? Cholesterol is naturally produced in the body, but it also comes from some of the foods that we eat. And high cholesterol develops when too much cholesterol builds up in the arterial walls. So those specific foods that can cause cholesterol, again, we'll get into that a little bit later. Total cholesterol should be less than 200. HDL is our good cholesterol, so we want that number high. We want that to be more than 40. LDL is the bad cholesterol. We want that number less than 100. And triglycerides, we want those numbers to be 150 or less. Basically, we want a good control here because too much cholesterol can lead to blockages in the arteries, and that's not good for our heart health. So we can prevent this by knowing these numbers. And more importantly, we can prevent complications. Diabetes is a disease in the blood. Blood goes everywhere, so it affects many, many organs in our body. Our heart, our brain, our kidneys, eyes, nerves, and feet. How does diabetes affect our heart? So it can put us at an increased risk for having a heart attack and heart failure later on. It could also put us at increased risk for having a stroke. What are the risk factors for heart disease? Diabetes is a major risk factor. High blood pressure, high cholesterol, smoking, and obesity. All of these things are risk factors for heart disease. How to lower your risk? How do we take care of this? How do we mitigate this effect? For one, stopping to smoke. If you're a smoker, please contact a local Commit to Quit program. Knowing your numbers and knowing what those numbers mean. So not just knowing them, but knowing what they mean and what they mean in relation to what you can do to change them. Eating healthy and getting exercise can all prevent complications of diabetes later on. Now, diabetes is a leading cause of kidney failure, chronic kidney disease eventually. Think about your blood again being full of that sugar, and it makes it thick. And that's going to be more taxing on your kidneys to filter out that blood. So it can lead to chronic kidney disease. It's a progressive disease, which can lead to kidney failure, eventually dialysis as well, and possibly a kidney transplant. How do you lower your risk for developing this? Smoking is a big one. Controlling your blood sugar and your blood pressure, and regular kidney function tests from your doctor. Diabetic retinopathy. What that is diseases of the eye. So diabetes is a leading cause of blindness in the United States. It also puts you at increased risk for having cataracts and glaucoma later on. What can you do about that? Getting control over those blood pressure and getting control over your blood sugar. Also, you're going to want to get a yearly dilated exam. I've had many, many patients who've come in and they haven't had an eye exam in years, and their blood sugars are elevated to the point where it's making their vision blurry and there's vision changes going on, and a lot of times if it gets to that point, it can't be reversed. So we want to catch these early on, and getting a yearly dilated exam is one of those ways to do so. Also, you're going to want to call your doctor if you can't see or if you've had blurry vision. Researchers think that over time, uncontrolled high blood pressure damages nerves and interferes with their ability to send signals, leading to diabetic neuropathy. Neuropathy meaning the nerves. This being the fact, it can lead to tingling or numbness. It can lead to muscle weakness. You could have dry skin, could be a symptom of this. Bladder problems, basically you are unable to detect when you need to go to the bathroom. Digestive issues such as nausea, vomiting, or diarrhea, and sexual dysfunction. Anything that requires signals being sent from your body to the brain is going to be affected here. This would also be affected usually in the lower extremities, but it could be in organs as well. So that's why, for example, bladder problems could occur. So how do you prevent complications? Your feet are also affected. Washing your feet with lukewarm water and soap. If you can't detect it with your foot, please check it with your hand, or have somebody else check it if you're having neuropathy in your hands as well. You want to make sure you're not putting scalding hot water on those feet. Drying your feet well, especially in between the toes. Applying lotion, but not between the toes. You don't want to get too slippery and you could be at risk of falls. Checking your feet daily and making sure you don't have any blisters or cuts or redness. A lot of times people with diabetic neuropathy, they can't tell if they've stepped on something, so you just always want to check. You're also going to want to trim those toenails in a straight line and file the edges. Change your socks daily and avoid tight-fitting or dirty socks. That's going to put you at risk of infection. And wear shoes that fit well. Don't wear some shoes that cause blisters or that are very uncomfortable. Wear shoes that fit well and check for cracks, stones, nails that may irritate feet. and never walk barefoot inside or outside. So how do you prevent those complications with the nerves and with your feet? Again, controlling those blood sugar levels can reduce symptoms and slow the progression of this disease. Controlling your blood pressure and being aware of what those blood pressure numbers are, as well as proper foot care as demonstrated on the previous slide. So let's review this first part, Diabetes 101. Diabetes is managed by what three things that we covered? Medications, nutrition, and exercise. What are the diabetic ABCs? A stands for A1C. Again, that goal is less than 7%. B stands for blood pressure, and that goal is less than 140/90. Being mindful, this is for people with diabetes. Cholesterol, we want our total cholesterol less than 200. We want that LDL, the bad cholesterol, less than 100, and the HDL, or the good cholesterol, more than 40. I always remember those numbers because H, we want high, L, we want low. So that's how I always remember those. What are your blood sugar goals? Your fasting blood sugar should be anywhere between 80 to 140. Again, this number is individualized. And after meals, you want your blood sugar to be in a range of 140 to 180, generally speaking. Thank you so much for coming to this first session, Diabetes 101. Our next session will be on diabetes medications.